Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Dr. Thomas Grove, how are you today?
Dr. Marc Darrow, I'm living it up, man. It's a great day.
You're pumped up. I know. I just texted you before the show, and you sent me a picture of the weightlifting bars you were using.
Hey, it's a great day to get after it, Doc.
I know. You got to pump those muscles, man. You got to fill them up. And the cool thing about Dr. Thomas Grove is he is one of the really the best injectors on the planet for regenerative medicine, platelets, and stem cells. A great, great talent for using the ultrasound to look inside the body, to diagnose, and to put the needle right where you're looking. So if you're getting injections anywhere by an orthopod, regenerative medicine doc, or someone of that nature to help heal your tissue, be very careful to use someone that uses an ultrasound. Otherwise, the solution may not be going to the spot that we need it to go to. I'm going to give out our phone number so we can get some callers. And we love talking to you. We love our callers. And the phone number to the studio right now live is 866-870-5752. Write it down. Give us a call. We're going to send you a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with the foreword by Suzanne Summers. And this book has, I think about, 256 studies. I'm looking in the back right now. These are scientific studies. It's 264, studies on regenerative medicine, platelets, and stem cells, and how it heals your body, and how it's so easy to do this. And the studies also show that surgery is failing people. It always has. We always knew that, and now it has been studied. Surgery may be needed, but in many of the cases, especially those that we see, it should not be done. We get so many failures. Again, the phone number, give us a call live right now, 866-870-5752. Dr. Grove and I want to talk to you. Also, you can give a call to the office, and that number is 800-300-9300. There are people there that can speak to you now. And if you want to watch videos of stem cell and platelet therapy, I think it's a great website. We work on it every single day, and it is very educational in nature. It goes through all of the ways that the body can heal, some of which work better than others. And we think, from our experience, I've been doing this over 27 years, Dr. Grove over a dozen years, that regenerative medicine is the way for orthopedics. Now, if you've got a broken bone, that might be something different. But a herniated disc, a meniscal tear, rotator cuff tear, arthritis of the hip, neck, back, most of those things we can heal by simple injections with thin needles. So the website is www.jointrehab.com, www.jointrehab.com. So I'm going to take a peek here. We've got a call coming in, and in the meantime, we'll start talking a little bit about something I just mentioned, that surgery is not necessary most of the time. Dr. Grove, do you remember the patient that came in yesterday with severe hip arthritis based on an MRI?
Yep, exactly. So,
but what we're gonna do is we're gonna hold that thought, Dr. Grove, because John has a torn muscle in his thigh. Let's take care of John first. John, Dr. Marc Darrow and Dr. Thomas Grove, what happened to your thigh muscle? Hello, thank you so much for calling in.
All right. Well, I have a torn muscle in my thigh, and I saw an orthopedist, and they gave me a prescription for physical therapy and also a number of exercises I'm doing. On top of that, I'm getting some electronic muscle stimulation and doing exercise, and I've even gone to acupuncture and gotten some deep tissue work. I don't think it's getting any better, and I was wondering what protocols should I be following to help this thing heal?
Well, first of all, how long ago did it happen?
5 weeks.
Okay, so you're still in the healing phase. Dr. Grove, you want to run with this one?
Yeah, so in terms of the muscle strain that you have or a tear, did you have some imaging?
Yes, I had ultrasound, and the orthopedist has just finally ordered an MRI, which I'm waiting to get.
Okay.
And which muscle is infected here?
It's the thigh muscle, the one that runs straight up and down the front of the thigh.
Okay, maybe like a quadricep muscle?
Yeah, I think it's a quad, actually. Right.
Yeah, certainly. So with muscle strains, typically they're going to heal pretty quickly because they have a good blood supply. And so after, a couple of weeks, if it's not getting better, then you can start considering something like regenerative medicine that really supercharged that healing process for you. But again, I got to put hands on you, do a proper physical exam, and give you some more information based off of that. But we see muscle strains all the time. I've had a lot of
which part of your thigh is it
tears.
In terms of what we call proximal, close to the hip, or distal, close to the knee, or somewhere in between?
There's a very hard mass about the size of a baseball, I guess.
Oh.
And that's it's probably 7 inches up from the kneecap.
Okay. So the thing for that is you need to have Dr. Grove, I would say, who's probably the best in the business, take a look at it under ultrasound, see if there's a fluid collection. If there is, we can aspirate that immediately and give you immediate relief. If it's a hematoma, which is a collection of blood from a tear, that's going to clot up, and that's going to take a really, really long time to heal unless you get the fluid out. If it's an actual tear, it depends how wide of a tear it is and whether regenerative medicine will work or not. I've treated tons and tons of those with amazing success using platelets or stem cells. So that's something that I would get on sooner than later. The longer you wait, the worse the condition can become.
Yeah, so you can get
right.
calcification of these tissues. It's called myositis ossificans. I don't know if you guys have ever heard of that before. We see a lot of this in hematomas and big muscle bellies. So if I have like a football player and they take a helmet to the thigh, and we're doing the day after shakeout run after a game, and I put the ultrasound on them, this heals really quick when you get that fluid out.
So what we do with that in terms of, it's called aspiration of the fluid. We numb up the area with a teeny needle so it doesn't hurt, and then we can put a needle in there that can aspirate out the fluid. And if it's red, we know that it bled, right? If it's,
right.
So that's diagnostic right there. So I don't know why the orthopod did not even do that. But that's not saying good or bad because we're not there to know what's going on. But if you've got something that big, then I'm going to guess the ortho did not see a real muscle tear that needed surgery. So it's something that regenerative medicine would be very good with. And I've had many of these tears that have been operated on, and that helps because it pulls the muscle together. But they still need regenerative medicine. When there's something major that happens, the soft tissue around the operation site still needs to heal. So this is something, I'm not saying it's an emergency. It seems like you're getting around okay, but it's not something I'd want to keep going on my thigh. I'd want to get that fixed immediately. And most of the time, the things that we deal with don't need an immediate response, but this is one that I would say do it now. And I'm going to give you the number of the office if you do want to call to make an appointment. That's 800-300-9300. You can go through physical therapy if you want. You can take the long route. And I'm not saying physical therapy is good or bad. I don't have a judgment on any other doctor or modality. But I'm saying if you want to get this done quick, you got to get fluid out of there. Okay? And again, my assumption is it's not a major tear because the surgeon would have said we need to operate right away, and he didn't do that.
Right. Right. Now, to make an appointment, should I bring in the results of the MRI?
No, we don't need the MRI. We don't need any of that. We do it live. Yeah, we don't need that. Yeah, it's better off. It's better off if we're doing it live, and in our hands we can see what's happening, and then you can treat it immediately if you'd like to.
Excellent. So I'll get that number, and there's people there now, or
yeah, there's people right now. 800-300-9300. If they're busy, they'll call you right back.
Okay. Well, I certainly appreciate your time, doctors. Thank you so much.
All right. Good luck with this, John. It sounds like it's an easy fix, and it's one of those kind of things. You can't turn the clock back, but if you'd come in to see us right away, it probably could have been helped right away, instantly. 5 weeks is too long.
Yeah. All right. Well, once again,
for me it is.
Thank you so much.
Yeah. God bless you, John. We appreciate it.
Yeah, you
All right,
too.
so I'm going to give out the phone number to the studio. It's 866-870-5752. 866-870-5752. We've got a call from Dr. Weinzoff. I believe that's Dr. Randy Weinzoff, who is my favorite chiropractor on the planet. Go for it. Is that Dr. Weinzoff? Hello, Dr. Weinzoff. Are you still with us?
Good to talk to both of you guys.
Hey, how are you?
Hey, good morning to you.
Great. How you guys doing?
Good. I'm going to give a little background on Dr. Randy Weinzoff. His office is in Santa Monica, California on Broadway. And I'm going to give out his phone number because I love this guy so much. I'm going to give him some kudos and a pitch here. His phone number, write it down, 310-395-0260. If you've got a sciatica, this is the guy to go to. When we're done working on back pain or neck pain and someone still has pain down the arm or leg, they go to Randy Weinzoff. He is able to, without surgery, in every case that we have sent him, get rid of these sciaticas very quickly, sometimes one treatment. And Randy, there's a case that I sent to you many, many years ago that convinced me that you are the king of sciatica and radiculopathy. Radiculopathy means that the nerve which starts in the spinal cord coming out through the foramen in the vertebrae called the radix, that's why it's a radiculopathy, is pinched in some way. It may not really be that. It can look like that. But what Dr. Weinzoff did with this one case, a man had what I'm going to call a dead leg, and he was ready for surgery. Randy, do you remember that guy years ago?
Yes, I do. It was
my first patient. Yeah. And he walked out of your office without pain. And tell us about what did you do there to actually help him?
Kind of the difference when you go the orthopedic approach versus what I do is I'm looking more to the skeletal system like an architect is looking at the frame of a building. And when I took an x-ray of him, his frame, if you will, was completely crooked, which means that all that disc cushioning material sitting between those vertebrae are not sitting straight. They're not flat. So it pushes the disc material into the canal where it touches the nerve root. And really all I did was I straightened out his building with gentle chiropractic low back adjustment, and the disc shifted off of that nerve root, and the pain left his leg, and now the electrical conduction from the spine to all those muscles started to function again.
That's amazing. It really is amazing. And I have sent you, I don't know how many, probably 30 people in the last couple of years. And these are what for Dr. Grove and I are things that we can't handle. We're just being honest. Usually people will come in to see us with neck pain or back pain, and they don't have this radiculopathy kind of thing. But if they do, we can generally get rid of the neck pain or the back pain, the localized pain, very easily using stem cells or platelets. But then sometimes there's a residual pain down the limb that we send to Dr. Weinzoff to heal up. So where did you learn how to do this, Dr. Weinzoff?
Well, I went to, originally I was a chiropractic patient myself, which is always a great place to start. You know, you do things that they work over and over and over. And like Dr. Grove, I was always an athlete, which means you're always going to have some form of injury. And, we have a lot of, general medical practitioners within our family, and the painkillers and anti-inflammatories just for a young kid was not a great idea. So I started getting some chiropractic work done through my parents taking me to a chiropractor, and it just worked terrifically, and it worked fast, which is nice because as an athlete, you're able to get back on the field quickly. Yeah. So I decided to become a chiropractor, and I went to Palmer College of Chiropractic.
Well, God bless you, man. We're grateful you're there. And Dr. Grove and I are both what I'll call holistic doctors, meaning we look at the whole body. We have people come in with they come in with any kind of musculoskeletal pain, orthopedic pain, neck pain, back pain, joint pain, muscle tears, you name it. And Dr. Grove with the ultrasound can inject literally anywhere on the body because he can see where he's going. He keeps it safe. And I don't know, I'm just amazed at how we find things in people. We had a doctor come in yesterday, a 70-year-old doctor who had multiple organ issues, and we went over every single one of those, from Lyme disease on up, because we're interested in the patient. We don't look at a patient. He actually came in for hip pain, back pain, and neck pain, and we address that first, and then we address all the other issues because we're interested in the whole person. That's what holistic health is all about. And with that comes the integration of different medical type practitioners like Dr. Randy Weinzoff, who's a chiropractor. We don't look down on anybody. We like to work with other doctors and chiropractors and acupuncturists and physical therapists, whatever it is, because everybody has their value. And what works for one patient may not work for another. Dr. Randy Weinzoff, I'm going to give out your phone number one more time if anybody needs an amazing chiropractor for radiculopathies, pain down the arms or legs. His phone number in Santa Monica is 310-395-0260. Dr. Weinzoff, God bless you, and thank you so much for all the help you've given our patients over the years.
I appreciate the time, and I've got 2 torn meniscus knee patients coming your way from this week.
Oh, great.
I know you guys can correct those problems without having to go in and have an arthroscopic surgery.
No, we're not for the surgeries, and the studies show that they don't work. Why cut out tissue and destabilize the integrity of part of the body? It makes no sense to me.
Exactly.
All right, God bless you, man. Thank you so much.
Thanks for the time. Have a good day, gentlemen.
All right, thank you. So we're gonna go to Cynthia in just 1 second. I'm gonna have to Dr. Grove take that one about her ankle. But in the meantime, for those of you that want to call us, get your pencil and write down our number in the studio. We love our callers. And the phone number right here, right now, 866-870-5752. I'm going to repeat it, 866-870-5752. You can also call the office at 800-300-9300, 800-300-9300. And you can watch videos of us doing these procedures live. When you're watching, it's not really live, but it looks live.
Yeah, they are recordings.
They are recordings on the website, which is www.jointrehab.com. That's JOINTREHAB.com. And for anybody that contacts us, we will send you a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with the foreword by Suzanne Summers. I had the very good fortune to work on her body many times. Her son Bruce still comes into the office, who's an avid athlete, and I've taken care of her grandkids and her husband and Alan Hamill, his family also. So Dr. Grove, do you want to take Cynthia here and see what's going on with her?
Yeah, absolutely. Cynthia, good morning to you. Dr. Thomas Grove and Dr. Marc Darrow, how can we help you?
Hi, yes, this is Cynthia Aguilar. I'm just tuning in. So the reason why I was calling is because I got into a motorcycle accident, and I was a pre-athlete. I was a pro wrestler. I was a stunt artist, and my whole past life, just vanished in a glimpse due to a motorcycle accident. And luckily, I was saved by an angel. My ankle was hanging by a thread, so when I got hit, my ankle got stuck on the front bumper of the car. So when I tried to get up, I saw that my ankle was deteriorated, and when the ambulance came, they saw no hope that I would get restored. So luckily, there was a guy on the street that had a belt, so he used someone's belt, this doctor on the street, and made it into a tourniquet. So they said the only reason why my ankle was saved was
Hey, Cynthia, do me a favor. This is Dr. Darrow. Can you scream at us a little bit louder because you're a little bit quiet?
Oh, I'm sorry.
No, it's okay.
So basically, can you hear me now?
Well, I could hear you before. I just want to hear you better for whatever else you have to say.
Okay.
Yeah.
So basically, there was a guy on the street, a doctor.
No, we heard that
someone-
story. Go on. How are you doing today? What's going on now?
Oh, yeah. So basically, I've had 2 surgeries already. My ankle had died previously from the first surgery, and I'm still in pain every single day, and I wish I can get back to my normal activities. I mean, I still bodybuild and I still work out, but I just can't do the same things like I used to do, like run. I have very limited mobility on the ankle, on the talus bone, so that's the reason why it's really hard for me to even bend my ankle the way my right ankle does.
Okay, Dr. Grove, what do you have to say?
Yeah, Cynthia, first of all, it's a really sad story. I'm so sorry to hear about that. That's really tough as you're an athlete and you're used to being a certain level of activity, and that's tough. Really sorry to hear about that. What surgeries did you have done? Did you have, like, fusions?
Yeah, so the first surgery was just to potentially amputate it, but they were able to save the ankle. I got really lucky due to experimentation. Then the ankle died, so I had to get another reconstruction surgery. The first surgery, I had to get 2 surgeries that same day, sorry. And then the third surgery was because my ankle had died, so they had to do a bone graft from my hip and put it on my ankle so that there would be blood flow. So they attached it to the talus bone, basically like a graft type of surgery.
Sure.
Yeah, but even then right now, because they put a screw in the middle of the talus bone so that it can finally get stuck together, but my ankle is swollen 24/7. Like, the swelling never goes down, and it's already been about 5 years since the accident. 2017 it happened.
Yeah.
We'd
So,
have
Doc,
to
I don't
look
know
at
if you have
that
much
one.
level 1 trauma experience with these kind of surgeries. This is like a limb salvage surgery, but these do really well with regenerative medicine. There's a lot of research looking at increased blood flow and regenerating and rejuvenating that area, especially post-operatively. So I can't guarantee anything, obviously, and I got to take a look at you, look at the ultrasound, hands-on physical exam, see exactly what we're working with. But we see patients like yourself in the clinic every week.
Oh, wow. And what's the name of the surgery?
No, I'm saying in general, it sounds like you had a limb salvage surgery, meaning you're trying to do some vascular
Cynthia,
surgery.
we don't do
that.
surgery. What we do is we inject with cells from your body that help heal the tissue. And we've had many, many surgeries that have happened to patients like this, and often regenerative medicine of stem cells and platelets from your body can help that heal back up. We're not going to get you perfect, but we may get you back on the field again. Okay?
Yeah, that would be great. I mean, I'm supposed to get another surgery, but due to COVID, I wasn't able to get it.
Hang with us, Cynthia. We're going to talk more. We're going to the break right now, so everybody hang with us. And if you want to call the studio when we get back, call 866-870-5752. That's 866-870-5752. If you want to call the office and talk to our staff, 800-300-9300. Look at the website right now, www.jointrehab.com.
You're listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.